We are going to show the film, and then we're going to have some conversation, and I'll introduce people and get them to introduce themselves on what we grandly called a panel. So you've got that to look forward to, but a quick film first with our friend Vince Cable.
I'm Vince Cable. I'm very sorry I can't join you. I wanted to do so because I've got to know RemindMeCare over the last few years in my previous work as an MP, which is a company doing really valuable pioneering work in the key area of respite care for people with dementia. I heard about the company a couple of years ago in one of my constituency surgeries, trying to expand. I was able to guide them to some of the systems now providing innovative forms of finance, which I'd helped to launch as Secretary of State, the system of crowdfunding through internet platforms, and I think on the back of that they were able to raise money. And so I've got an interest in the company on several levels, but I think what is really important, and the reason why your meeting is so important, is that it enables us to take forward this absolutely critical work in dementia care, putting it onto a much more professional, digitally based system. But thank you for listening, and I'm very sorry I can't be with you.
First of all, I'm going to ask Sam to say a few words. Sam's the Chief Executive of Age UK London.
But what is really interesting, I think, about the Remind Me programme is that it enables those kind of services to be very portable, that kind of support, that individualised support which is built around the person, to be very portable. So it could be shared with a person providing that service, a support worker within an Age UK context. But also it enables the family member to understand what's going on in that one-to-one supported environment in the community. And as we were told earlier, it can actually enable that also to be passported through to other support if someone goes into respite or if someone goes into hospital. So the portableness of it, if that's such a word, portability is really, really useful. And I guess the final thing I think I want to say is that many assistive technologies to actually enable people to stay safe in their home is built around avoiding risk and keeping people safe. And actually this is the opposite of this. This is actually about celebrating life and celebrating what this person had to and still does have to offer within their life. And for me, that actual whole viewpoint of looking at someone's life and the fantastic contribution they've made to their family, their community, is something that, again, is unique and special to this.
Thank you very much. Deirdre, does it feel like that for you? Does using this feel easy and simple?
Have you discovered through use of Remind Me much about your past? Has it made you remember things?
Yes, it has. Yes, it has. And I'm very happy about that because I had a wonderful childhood, very loving and interesting family, and
so it's all
lots of humour and, wonderful, and animals everywhere, and, it was great. I had a wonderful.
I think I would go so far as to say it was inspiring.
Yes.
I really mean that. That's not just an idle chat.
My mum had vascular dementia, and there were some things that I knew in her past that she really enjoyed doing. And one of them was watching Maygrey. Now, that was a series that was on in the 50s and early 60s. And that, if anything, I didn't need the sales pitch from these two. I mean, I just knew from seeing the effect of picking on something that I knew would amuse or inspire or whatever the word is, my mother. And I thought, God, if there was if I could have done that with this, if I could have had this and done it so much easier, I would have had it like a shot. The other thing that really impresses me about this is the fact that it goes across ages, and I don't think enough's been said about something that identifies a common point of interest, which is what this does so easily, is a tremendous thing, particularly if you're doing it at a distance. But then having seen it, and I thought, right, you're pushing like hell to get it into care homes, or that's what you're pushing to design it for care homes, and actually there's a real need to have it in hospitals as well. And so luckily, because I've got a good relationship as a patient leader with the Royal Berkshire Hospital. I asked them if they would work with Etienne and Simon to see how the system needed to be altered or changed or amended or extended, if you like, for it to be useful in a hospital setting. And in that respect, I can't remember how many visits Etienne had with the hospital, but not that many, and they think it's absolutely wonderful. And other hospitals feel the same, because when you get a lot of people on an elderly care ward who have dementia and you have a very limited number of staff on those wards, unfortunately, it's crucial to find something that will keep people occupied.
Margaret Dangor. I'm a carer for my husband with dementia and very active in carer issues and dementia issues in various ways. I would like to see it available for all older people, because I would like to build up my history now. You know, I can give permission as to what I want included, etc., so that I can do it over time and really be selective, because, 1 in 3 people over 85 is going to develop dementia, and I think you almost need to do it, very early, and I just think that's something to really work on with possibly one of the major charities to sort of do the promotion. But, how far can you go, really? I will say I introduced you to Sue Hodder, running the pilot at HomeLink, so, I just mentioned that, and she's delighted with it. But I think there's a great capacity there to look wider than dementia, really.
But I think for me, the essence of why this is such a fantastic idea is that it enables formal carers to get as much information working with families and those people who are really important to the person that we support. The more information that you have, the better you can support somebody and interpret non-verbal behaviour. The more we know about somebody and the more we involve family and friends, we can reduce the incidence of depression. Again, that reduces the use of medication. It is a win-win for everybody. I firmly believe as well, by offering the opportunity for care workers to work with the people that they support in a very proactive and really positive experience, actually makes the sector more attractive for people to work in.
One of my areas of expertise is memory. And another area is actually communication. I want to end just with a quote that came out of this conference, which was looking at care home, sweet care home. What do we want? And this was a quote from somebody who worked in social inclusion, and they said, when you walk into a care home of the future, you should hear laughter and conversation. You should see activities which engage others, not only individually, but connect fellow residents together, so that a resident's confidence and self-esteem are maintained and their identity is kept whole. And I think that's sort of quite a nice way of sort of summarising what the potential is, I think, of Remind.